If you're a runner who has been experiencing pain in your hips, or you just feel like there's a lot of tension in and around your hip capsules here, you're not alone. You are human, and the majority of people in our society are not properly mobilizing their actual hip on a daily basis, and so people get really tight and stuck over time. This can lead to hip pain, tight IT bands, knee pain, low back pain, as well as just any sort of pain in the lower extremities. So I'm going to show you a simple ground mobility routine that you can do after your run to really open up your hips. And this is going to be really geared towards getting every single part of that joint capsule, as your hip is supposed to rotate in and out and flex and extend. So we're going to make sure the entire joint is really healthy. So first and foremost, I do want to say I have a standing mobility routine that you can do before your run and is a little more easy compared to what we're gonna be doing now. So if you're just starting out, I highly recommend checking out that video first, and then this is something you can do after your run to really start to mobilize and get everything moving in all these different plane lines. First and foremost, we're gonna start with a squat. So if you don't have the hip mobility to go all the way down into a squat, feel free to hold onto something like a chair or the wall as you guide yourself down. Know that you can do that. I'm going to show you here without doing that. First, I'm going to keep my spine and my belly tight. My heels stay on the ground. I'm driving my knees outward, and just this alone is really starting to stress the hip itself and start to open things up. So I can sit here, breathe, drive the knees out, bring my pubic bone forward, keep my spine nice and straight. I can challenge my shoulder range of motion. So many different things you can do here just by doing a simple squat. And it's also a great indicator of where you may be lacking proper function in your ankle, your knee, or your spine. So now getting into this even more, what I want to start to encourage you to do is start to bring more weight onto one side as you push the other knee away as you're opening up that inside portion of your groin. You can challenge that even more by keeping one hand on the ground and bring the hand all the way up. So if you have the hip range of motion, this is going to start to mobilize your upper and lower spine as well. Switching legs, pushing into that leg as I keep my big toe and my heel on the ground. Hand goes down, reaching all the way up, sit the butt back down, keep the spine nice and long, and then reset. Now we're going to create some length in our quads. So in this position, put one heel stays on the ground, other knee is coming down. Here, breathe, come back up, switching legs. Down to the ground, just touch, come back to neutral, switching legs again, go back down, switching legs. One more time, there we go. If you have the range of motion, now we can just let ourselves come into a lunge. So in this extended lunge position, bring your pubic bone forwards up towards your sternum. By tilting your pelvis back into this posterior pelvic rotation, you're opening up that quad and hip flexor and starting to open up your hips even more. You can bring that same All right, so now we're going into a couch stretch. I don't have a couch available, but I do have this wall. So I can scoot back and bring my foot up against the wall here. You can do this on a chair or a couch or any type of ledge. In this position, again, still breathing, but this time I can push my foot into that wall or couch or chair. And as I bring my hips forward, this is getting way more into the quads, and the quads have the same connective tissue fibers that intimately connect to the hip flexor and psoas as well. So just breathing, stretching, and then switching legs. Other leg goes down, this leg forward. Again, knee is over ankle, pubic bone tucks forward, big breath in, hips forwards as I feel that open up in that right side now. Arms can come up or roll to the opposite side, and hips come forward as I open that side up. If I want to go into that couch stretch now, opening this, pushing my foot into that backside, feeling my quad engage, and then starting to stretch and open up here. There's tons of different variations you can do with challenging yourself up more. But mostly this is gonna get more of the quad than it is the actual hip, but you're gonna also be stretching open the hip capsule. Now I'm gonna be going into my favorite move, which is 90-90. So my legs here, 90 degrees as I'm on the ground. This for a lot of people may be challenging. For me, I feel it into this left side, and so I can just put some more weight onto that left side, and I'm getting internal rotation of the hip capsule while the external fibers are starting to really open up and stretch. I can pull my tissues and guide them along that process to open up even more. I can push the other way just to get the actual hip capsule. In this position, spine's gonna stay really nice and straight. Breath in as I then use my balance and hip and core stability to switch to the other side. In this position, this side is a little easier for me, so I notice I should probably spend more time on that hip. But again, I can put some weight to try to get both butt cheeks down on the ground. I can guide that hip into different external, internal rotations just to get the myofascial units involved, as well as the actual bony joints themselves. Spine stays straight, switching to the other side. Slight variation now here. I'm gonna be using my core, squeeze my butt, and bring the hips all the way up. In this position, I really can start to open up my hips and then now get the back side of the hip fibers by just hinging from the hips and counterbalancing with my hands. Spine stays straight, bring the hands up, butt back down to the ground, switching sides. Core stays nice and tight. I'm not rotating my spine or flexing the spine. Hips come up by squeezing my glutes, and then hip hinge, coming down, getting the external hip rotators with the leg that's on the ground, and then all the way back down. Now, a lot of people have decreased rotation of the hips, so we're gonna go into what most people like to do for stretching their groin, which is a simple child's pose, but you can bring your legs together as your knees are spread, opening up by bringing your hands as far away from your tailbone as you can. In this position, big breath in. As you exhale, reach a little bit further, sit more into your hips. I could hang out here all day. Coming back up. And now we're gonna go into the hockey player stretch. So same position here, but I can bring my feet out, and now I'm driving my hips down to the ground and stretching in this position. So opening up that front part of the hip capsule, and now if I wanna get internal, external rotation of just one hip, I can bend that leg and go inward and outward with that knee, keeping my spine nice and straight still, not letting my belly sag, switching legs, bending, and then rotating. So I'm getting more of the active motion of that hip capsule. And then coming back down, I can finish that off with one more child's pose just because it feels so good. Breathe, sit back into the hips, reach forward, stretch the spine. Again, the spine has a very intimate relationship with your pelvis, the hip capsules, and all the hip flexor muscles. Now, in this position, we're gonna stay on our bellies. Arms can come out. So this is a modified scorpion. I don't wanna see how much you can rotate your spine, but staying really nice and straight. So tucking the chin down, dorsiflexing your toes. In this position, my belly is gonna stay super tight. I'm gonna breathe into my belly and my back, so breathing into my hands here. Holding that space and that contraction of my ab musculature to protect my low back, and then bringing that heel up and down. But I'm making sure that my left leg stays on the ground. In this position, straighten that leg out, dorsiflex the toes to get the front of the hip as well, and then switch legs. I'm pushing actively into the ground, big breath in. Stabilize the spine, leg comes up, bends. Then I can straighten and dorsiflex the toes by bringing the toes up towards my heel. Come back down to the ground. Stretching, opening. All right, so that is your hip mobility routine. I highly recommend spending some time loving on your hips, and they will love you back. If you can do this after every single one of your runs, or after you've spent a long time sitting on the couch or sitting in a chair at work, or after your long commutes, you're gonna make yourself a better, healthier, stronger runner because you're gonna have the mobility to actually increase your stride length and keep a nice stable spine so that other parts of your body aren't compensating while you're out on a run. My name is Dr. Jordan Fairley. If you appreciated the content in this video, like it, subscribe to this channel, tag a friend if you need to, any of your other running partners. And if you have any other running related questions, put them down there below. My purpose here is to provide you awesome content that you can implement right away to help you be a healthier, happier, stronger runner. I look forward to seeing you out on the trails. Wait. Before you go, I want to say thank you again for watching this video. And I also want to invite you to the Vital Stride Community Facebook group where runners like you are asking running related questions and I'm helping people overcome repetitive running injuries. I look forward to seeing you in the group.